Hello and welcome to Live with Amanda. Today we're going to be talking about the importance of niching down your website. So a lot of people will tell you like the riches are in the niches, right? Like we hear that. Like I'm imagining orthopedic surgeons are, they're a very specialized doctor that makes a lot of money versus like a general practitioner, right? That is their niche. They probably make more money. I'm just making some like assumptions here based on like what I know. And so it's the same for therapists. If you're a general practitioner, you see everybody, you do everything. It may look different. You may make less money than say somebody who specializes in high conflict couples through an EFT lens and they have an EFT certification and they're really like a sought after speaker on couples counseling, right? Okay, so something like that. So it's amazing and it's great to be niched down. But what I find is that there's a big disconnect between the therapist saying that they're niched down and then the marketing that goes along with it. And so you want to make sure that while you niche yourself, that you also niche your marketing and that you are really targeted in the types of marketing that you do. Meaning that it says it on your website, it says it on a variety of different places, not just that you say it and you tell people or people know you as that. That if you do EFT, let's say, that it is apparent and it is there on your website. And if you are a couples therapist, that it says that. And if you work with high conflict couples, that it says that. And that you have different service pages. We've talked about service pages in the past around all of these different niches. And that people can really understand what you do and who you are. I can say that my practice is a little bit more of a generalist practice. However, there are very specific things that we do, and we make sure that we have service pages on our website for those things. And other clinicians have gotten much more savvy in looking at therapist websites to see if they say, hey, we do this, and it's not on their website, they're like, hey, it's not on your website, you say that you do this. And so if you have a group practice in particular that you're trying to fill up, many clinicians, 1, 2, 3, 4, 50, 100, that you make sure what you do, not just what you say you do, but what you actually do is written on your website. The very best place to do that is under service pages or treatment types or populations. The most popular is under service pages. Under our service pages, we talk about treatments that we offer and populations that we work with or diagnoses that we work with. So we have a page for CBT. We have a page for like women's health. And then we also have a page for child therapy. So, right, like we're hitting 3 different types of audiences. And so if we say we do play therapy, we say we do children's therapy, people can see that on our website. If we say that we use CBT as a modality, it's on there. Or conversely, we also have pages for anxiety, which is the diagnosis, right? So the treatment, the population, the diagnosis. You don't have to set your website up in that exact way. That's just how we do because we really want people to know who we are, know who we work with when they look on our page and our webpage. And we also, a lot of the times, will do our AdWords specifically around those service pages. Or if I'm on Facebook and people are like, hey, do you do this? I will send a link to the exact thing that we do. So if somebody's like, hey, I'm looking for somebody with anxiety, blah, 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 I'll send them that. And so it's going to be really important that you look at your marketing and make sure that you haven't just said that you're this anxiety CBT expert. Let's talk about where else you can put that. But first, let's thank our sponsor, TherapyNotes. If you're looking for an electronic health record that's really full service, that can help you work the back end of your practice and the front end with telehealth and billing insurance, taking credit card payments, but also like the back end of the paperwork and the reports and all of that stuff to help keep you organized, I definitely want you to check out TherapyNotes. The layout is really great. There's to-dos. You can look at all your billing. You can look at all your clients. They have assessments now that you can send your clients, which is a really helpful clinical tool out there for practices. And so I highly recommend you check out TherapyNotes. So look at your social media, look at your website, look even at the name of your practice or your email header or footer, I guess you would call it, the email footer. Does it in any way describe who you work with or where you work or how you work? Does it encapsulate your niche? Really think outside of the box and how you can reach people so they know exactly who you work with. So when people are asking, you're the go-to person, but when they look at your website, they look at your social media, they know that it is authentic and it is real because you have it on your website. And hopefully it is authentic and real in the sense that you have the training and the experience to do what you say you're doing. But I know that ethically, we are all doing amazing things and continue to do so on your websites. I hope this was helpful. I'll see you soon, everybody. Bye.